It's actually a privilege to have somebody as senior from the medical profession because it makes a difference when a doctor himself shares his hair journey.
Hair itself, it's so important, Automatically our aging appearance and self-confidence also will boost up once we'll have an hair.
At what age did you start experiencing the initial hair fall?
When I was doing my post-graduation, gradually this thinning of hair and the baldness has started. Then it made me more conscious when we started walking. While combing, it will be fine, and if you're entering some hall or mall or something, the air, it will blow off. Then I had to do something for that. Initially, I was also thinking in the same way. Once we'll come and get it done and go. But that is not the way actually. After going through the procedure, how we decided, split into 2 or 3 times. There is no post-procedural long-term medicine intake. That will be the best thing for the patient also.
When did you start seeing the results, that little initial growth?
After the head wash, usually it will shed off completely. For me, I think so. I have found that result very early because I didn't have a phase that, it was completely gone and we had to wait for so many months. So gradually the small hair in the follicles, they were coming up.
So it's been a year, and now how do you feel when you see in the mirror?
Some percentage of our self-confidence will be boosting up. We'll get some compliments also. In the end of the day, there should be some hair, so that they can do some hairstyling, etc. That is the best thing which you will get.
Hello, Dr. Abhilash. A very, very warm welcome on our channel Beyond the Mirror. Thank you so very much for being here with us today, sir.
Thank you for the warm welcome, Dr. Priyanka.
Thank you. It's actually a privilege to have somebody as senior, from the medical profession because, as you know, we speak to a lot of patients on this platform where they share their hair journey with us. What's more valuable is when somebody as senior, like you, because it makes a difference when a doctor himself shares his hair journey. I think people get more confidence and the trust in the process. So I think that conversation on your hair journey would be really helpful and valuable to a lot of them. But before we get into that, we wanted to first know, because I think you're born and brought up in Dubai. So your schooling would be here. And
after getting my license around 3.5 years, now I am working here in Dubai.
Right. So your medical college was in India?
Yeah, my medical college. I did my PG, everything from Vinaya Mission Medical College.
Okay.
Then further I did my master's in laparoscopy from Gangaram Hospital, Delhi. Then my bariatric journey I have did from Asian Bariatric Ahmedabad.
Okay.
And robotic also I did from Gangaram Hospital.
How many hospitals are you attached with?
I'm attached to 2 hospitals in Dubai and 1 in Sharjah.
Okay. So can you name those?
Aster Hospital branches only. In Kisais, Mohesna, then Sharjah.
Yeah.
Yes.
In fact, we've had several doctors from Aster Hospital, from of course different departments where we've interacted for their hair loss.
Yeah, some are my friends only.
Yeah, yes. You referred so many of them, yes.
Yeah, they're like they were, they were investigating actually, what to be done, where to be done, what is a procedure. Basically, everybody was worried about the outcome and how it will be coming. So for me, myself, what I'll say is that, I was just planning, is there any solution for the hair loss?
Yeah.
So as I saw about our Ashur clinic in Facebook, if I am not wrong. So before pre-launch itself, Dr. Priyanka, Dr. Abhishek, Dr. Piyush, they were over here, right? So I came here to take an opinion actually, what is a real thing, and I'm very happy that they guided me on the correct timing, what to be done and all. So I was also convinced and I could take a fast decision what to be done.
Right.
So once it was done, my other colleagues, those who were even briefly searching where to be done, in internationally, etc. and all. So they were also surprised. Initially I was not planning, and I was the first one to get it done.
Yeah.
So they were asking, how could you take a decision so fast? I told, I went, and they were very clear. and I was also convinced the way and why it was indicated. So I just go ahead.
Yeah. At what age did you, start experiencing the initial hair fall and the hair thinning?
Yeah, I have fall some when I was doing my PG, post graduation.
Yeah.
Then by second year onwards, I started thinking, a lot of hair fall is there. But gradually, this thinning of hair and the baldness has started.
Yes.
So then it made me more conscious when we started walking. While combing, it will be fine, and if you're entering some hall or mall or something, the air it will blow off.
Mm.
So then I thought, okay, no. Then I have to do something for that. So
Yes.
that's how, yeah.
Right. I'm sure because initially when you came, you said you took a quick decision, but you were not through any reference. You did your
Yeah.
own part of research. Did
Correct.
you research enough before kind of deciding? Because a lot of people want to have
Hmm.
that clarity. It's once in a lifetime procedure. So
Hmm.
how did your initial research start?
Um, See, many of them they were talking about this PRP and some other medications will help, for hair loss
Yes.
and all. So I was not thinking to continue, with the medications alone. So PRP, how far it will be helpful? As a doctor, I also have some idea. So I was thinking anyway, it's not. I was thinking it won't be going for the new hairs to come, right?
Yes. Yes.
So that's how I decided. This was the first time. I went in person to get a consultation. That
Yes.
was the first time
Yes.
with
And
Ashur
our
Clinic.
clinic was not even started
Yeah,
yet.
yeah, yeah,
We
yeah.
met up at
Actually,
other location
yeah, it
for the
was
initial hair
pre-launch.
check.
Yeah,
Yeah, it was the
that I
pre-launch.
agree. That I agree.
Yes.
So the arrangement, and they showed and they explained so nicely, so I was also convinced with
Yeah.
my own hair photos, and they told,
Yeah.
these are the things to be filled.
Correct.
So then I thought, okay, this logically good, and
Yeah.
this is the correct time. Yeah.
Yes. Now, based on your schedule, which is, very hectic, so many surgeries you have per month, how did you plan and how did you strategize that time? Because obviously, your own work where you are dealing with your patients is not easy. So,
That is the one main thing which I would like to say, because yeah, it was very friendly enough, to arrange according to my possible feasible time, and they also managed even in the morning also whenever I scheduled they arranged, and it was done not in a one sitting.
yeah,
It was split up in some different sessions,
two
but
phases. Yeah.
yeah, two phases, but. The timing was very feasible for us because us we might be having some emergency cases, and the
Yes.
plan thing may scheduled, and it may get
Yes.
changed, but all
Yes.
I mean, from Ashur Clinic they were asking whether you are confirmed, whether you are able to come, etc., and all. They never refused, this particular time we cannot do, and all.
Right.
So that
Right.
was, I was very comfortable. That also the main thing which I was very happy to
Yeah.
recommend for my
Right.
other colleagues. Yeah,
So roughly, I think 3 to 4 hours used to be
yeah,
a procedure.
yeah. That was also in a short breaks, and I was much comfortable. It is not like very hectic thing and feeling
Yeah.
lightheaded and that kind of issues I never
Yeah.
faced, and that was also while consultation itself they have advised like that only. They
Yeah.
never told we have to get it done in a one sitting.
Yeah.
Initially I was also thinking in the same way, once we'll come and get it done and go, but that is not the way actually. After going through the procedure, how we decided, like split into 2 or 3 times, that will be the best thing for the patient also. As a patient, I am feeling that will be the best thing. Yes.
Right. On the day when you get your procedure done, let's say in a morning session, how would you then manage your work? Because I think there would be some amount of pain, swelling. So were you able to do your own surgeries then?
Definitely, there was not much hindrance of pain. I that day also I have gone to my office. I'm in a hospital. I have consulted. I didn't. In some of the days, even I did
Yeah.
surgeries also.
Oh.
So in that way, I think you can trust and come. You can plan your procedures accordingly.
I think this is going to be very valuable because a lot of people have that fear of pain and they feel that good 10, 15 days now they won't be able to go to work.
Yeah, yeah.
In fact, for them, the work is not as difficult because probably
Hmm.
it's a closed environment and it's a desk
Correct,
work.
correct.
For you, it's a more stressful
Yeah,
job because you're actually operating on patients.
yeah,
So if you could manage it with your surgery, I think that will give that confidence to
yeah.
everyone.
That's what I'm saying, so that they can understand how you will be feeling.
Yeah.
But less pain, yeah, less pain, yeah. Initially, that also they will be explaining where in which session we will be having more pain.
Yes.
That was very useful, so that I can also plan accordingly.
Correct.
Otherwise, yes, in some cases I have gone after the procedure also, because I didn't feel much difficulty. Otherwise, I would have
Right.
planned later.
Correct. Correct.
Yeah.
When did you start seeing the results, that little initial growth, and then what were you thinking during those few months?
Initially, yes. After the head wash, I was also thinking, head wash, usually it will shed
Yeah.
off completely.
Correct.
So then they gave the brief idea that, after some time, gradually, once it will grow. And for me, I think so. I have found that result very early,
Mm.
because I didn't have a phase that, it was completely gone and we had to
Yeah.
wait for so many months.
Mm.
So gradually, the small new hair in the follicles, they were coming up, and one more highlight I would like to say that there is no post-procedural long-term medicine intake.
Yeah.
So only the minimum required prophylactic antibiotic for the time being. There is no other continuous intake of medication.
Yes.
So that is also a plus point which I would like to
Yes,
add.
I
Yeah,
think, yeah, because there are a lot of people who do ask about the maintenance part post procedure. There have been people
correct.
for a year or two
Yeah.
taking a lot of hormonal tablets and
Yes,
supplements,
yes, yes.
topical lotions. So
Correct.
we are free from all that, which,
Yeah, that is.
yeah.
This question was there prior to the procedure. Everybody will be having this. Post-operatively, we have to keep on spraying, or we have to apply some ointment or something like that. But a very initial time itself, doctors, they have told me that after the procedure, minimal care, and like you can be like a normal, normal hair.
Yes,
How I take caring that,
correct.
and that was very helpful for me. I got an idea saying that hair itself it's so important.
Yeah.
Once the baldness comes, automatically our aging,
Yes.
the appearance and little bit of self confidence also will
Yes.
boost up once we'll have an hair.
Yeah.
I was also very happy to
Yes.
to have a good hair.
Yeah. Apart from your patients, I'm sure you mentioned even your colleagues were noticing.
Definitely, because my colleagues, I told right, they were researching, they were going. Everybody is much worried about the results.
Final
So
outcome.
when they asked me, also, I told, okay, then if you're that much worried, you just wait, because daily we are seeing, right. You
Yes.
can take a decision after that. I myself, I told like that.
Yeah.
So after that, only after saying this, then they told, okay, how is the pain, etc. And all. Then they fixed
Yes, a
appointments.
lot of
Which,
doctors
yeah,
from Astor that you've referred have come for the
yeah.
procedure then. Also, at least in our field, in the aesthetic field, we've noticed that people have a lot of faith in Indian doctors.
Yeah.
I think globally now, so many people worldwide, they do travel, come. Though, of course, Dubai, Turkey, these are hubs for
Yeah.
aesthetic procedures. But with Indian surgeon, I think that comfort is there. What's your take on that?
That is completely personal, but still, yes, if I prefer to go, yes. Some Indian doctors are there, yes, I'll go. And why preferably I took over here, my decision to get it done in Dubai and an Assure clinic, because just before when I was taking the decision, they were telling, why can't we go to internationally, why not go to Turkey, and somebody has called me, and by my thoughts were very loud and clear, saying that I don't want to go if there is some issue again to phone to go there and get consultation. No,
Yeah.
I want an easy access
Yeah.
and flexible timing for my work. So that was provided very well from our Assure.
Yeah.
So I'm happy, and I always recommend the same thing.
Somebody who wants to listen from you, that'll give them a lot of confidence because, like I said, when a senior doctor himself has experienced it and his experience he shares, what are those five, maybe I would call it tips that you would give somebody who's in the research phase, somebody who's trying to shortlist clinics or not even very confident whether he should opt for a transplant with a worry of whatever the side effects and all. Five important factors one must keep in mind while they are taking a decision
Yeah.
for a hair transplant.
The very first thing which I'll say is that you should consult and get the opinion from the experts whether to go or not. And second, it should be, according to me, it should be an easily accessible for everything, before the procedure, after the procedure, follow up, everything.
Yeah.
And then definitely you should look for the genuine results, not only just like that. You can just ask them, and here in Assure they are ready to show their previous work also, and you can also investigate, so that you'll be happy. And I myself, I'm working here, I'll be working here also for some more time. So definitely you'll get an idea, as a doctor, as a surgeon. I am also thinking, it will be a good decision if you're going. I think you will be convinced after the procedure. Then about the pain, yes, not much of pain, but see, as I told, you can resume back the day after the procedure. If you want to go, you can drive yourself and you will be more comfortable. So we cannot say completely, we are not giving general anesthesia or
Yes.
something.
Yes.
So there will be some, you will be comfortable enough to go do your normal routines after this. And the fifth one, there is no post-operative medication to be taken. So I think that will be the highlight, which you will be looking for, all the things. Pain, medication, and how you will get convinced.
Yes, yes. One last question on this, because a lot of people ask us during the consultation, who will do the procedure? The ones
Yes,
who
yes,
are
yes.
researching. So obviously it's a very time taking, it's a tedious work of 10 hours sitting and grafting. So we do see that the surgeons have a certain partial involvement, and then it's their team who takes it forward. What is your take on this? Because you yourself, you do your own surgeries, right?
Yes,
So
yes.
similarly, even though it's an aesthetic procedure, I think it is a skillful job. What is your opinion on this?
See, as I told, initially I was having a thing planned to get it done in one go, because that was the thing which every hair transplantation places they will highlight. You can come, get it done, and you can leave the place, same time. For that only they gave the answer that here basically, if I am doing one surgery, I do my surgery completely, and I do take care of my patients with my visit rounds, etc.
Start to finish.
Yeah, start to finish. So here also the main highlight is that doctors, experienced doctors, they are only they are taking from the donor side, they are only doing the transplant, and for them the precision, everything is very important. So that's what they told. They won't prefer to do it in one sitting, rather they will do it in 2 or 3 sittings. Then as a surgeon I can understand, so I thought, okay, that is the best way which we are telling, and that is a logic reason. So yeah, I prefer here. I think all the things are done by doctors only. Okay, and that Dr. Abhishek, Dr. Piyush, and
Yes, all
Dr.
the senior
all the senior doctors are there, and they themselves, they are taking the effort to take it from the donor and to implant. So that is the best thing which you will get.
So it's been a year, and now how do you feel when you see in the mirror?
Yeah, now I am very much confident. Definitely some percentage of our self-confidence will be boosting up. Then, we'll get some compliments also.
Yeah.
Everyone, those who are looking for any hair transplantation, in their mind, it will be one thing only. In the end of the day, there should be some hair, so that they can do some hairstyling, etc.
Correct.
So in that way, I am much happy, and I'm confident enough to recommend Assure Clinic to any non-person for me also.
Yeah. Any hair routine now that you've got the growth? Anything that you follow? How regularly you go for haircuts? Do you apply anything in your hair?
I did once I did one keratin treatment.
Yeah.
That everything is recommended by our doctors only. So because I was not a person, going and doing some extra things for the hair.
Yeah.
So once now the hair growth is there, so whatever thing is there, I always get a guidance from our doctors. So that day I asked Dr. Piyush also, say what to be done. Then he told, okay, you please go for the keratin treatment. Then Then again I took 1 or 2 times confirmation. Then I did it.
Yeah.
So that is the only thing. Otherwise, there is no much effort has to be taken. Like a normal routine thing, we can apply the hair oils and all. That's it.
we keep reading a lot of articles and news
Uh,
of certain popular cases, very complex cases that you've dealt with. Can you probably
yeah.
share a few of those? Very recent
Uh,
one I read was a 12-year-old girl.
yeah.
Yes.
That was 12-year-old girl and 5 years, 5 years.
Okay.
Then one was 5 year of boy
Mm.
with an intestinal perforation and all. Now he's doing well.
Mm.
And 12-year-old, yes, there was an cecal volvulus that
Mm.
was also that was an emergency, and
Okay.
yes, their parents also trusted on us.
Yes.
Initially, there was some confusion where to go, etc., and all, but later
Yes.
on, it came out well.
Yes.
Yeah, and one more thing is that there is one DHL one patient.
Mm.
He was diagnosed with some renal calculi, etc., and all, but still
Mm.
he was having some pain over the right side.
Mm.
Then later in the MRI, we found out to be a giant lipoma intramuscular. So that also
Okay.
laparoscopically we did, and now he's doing well.
Okay,
So these
great.
are the some
So I'm sure
cases.
you would be seeing challenging cases every day, but any special case you have that you would want to share with us, which was very unique and one of the challenging ones in your career?
Challenging one was this baby, which I
Yes.
told because the whole together it was an emergency.
Mm.
I usually deal with all laparoscopic, and I am a bariatric and laparoscopic surgeon, not pediatric. So
Correct.
what happened is that this was an emergency.
Mm.
I was called to the emergency, and the baby was in so much of distress. There was no time for shifting everything.
Mm.
So we have taken as an emergency procedure,
Mm.
and it was gone well.
Yeah.
And there was one other recently which happened that was also in dual perforation, like
Mm.
small bowel
Mm.
and large bowel. Both was perforated, and
Mm.
patient was brought in shock.
Mm.
So that also we have taken up within another 30 minutes, 20
Okay.
30 minutes, after stabilizing.
Mm.
So that was also it went well. The
Mm.
patient came for review, everything.
Okay.
Yeah. So
So we have a quick rapid fire round, sir. So
okay.
we'll be asking you a few questions, simple
Mhm.
ones. So whatever promptly comes in your mind, you can answer those.
Definitely.
So the first one, what's the most rewarding aspect of being a laparoscopic surgeon?
The patients are able to go to early back to their routine, which is very, very important in Dubai concept.
Yes.
Yes, and less pain,
Yeah.
and they don't have that. Maybe the surgery is so big, complicated, but next day when we'll go for the rounds, they will see only some small minor
Yeah.
punctures. That's it. So,
Okay.
and their happiness, they're less pain and coming back to main
Yes.
routine work. That is the main thing.
How do you perceive the role of Indian doctors in the global medical landscape?
Till time, I think so. They are having their own stand. Many of them they will come. Even I have seen many Arabic patients
Yes.
also.
Yes.
They'll come if they have an option. They are coming and seeing us. So in that aspect, yes, they are having a good value.
Yeah. One of the longest surgeries you can recall that you've performed?
See, once we did one bariatric conversion surgery that was going for around 6 hours, I think. So that was
Was
a
a long
cost.
one.
Yes.
I've heard you know a lot of languages. I think you know Russian, Arabic, Malayalam,
Yeah.
Hindi. Any other language that you would love to learn?
See, some recently some German patients they were coming.
Yeah.
They are fluent with English also. So yes, I think so. If you are getting a chance, I would like to learn that
Yeah.
also. Yeah.
Okay. What's one of your favorite ways to unwind after a long surgical day?
I would like to listen and go for a long drive because I am crazy about driving,
Yeah.
but not on traffics.
If you weren't a surgeon, what other profession do you think you would be in?
I was a little bit interested in becoming a pilot also.
Okay, wow.
Yeah. I had an option, a pilot or a medical field.
What's that one ritual or maybe a superstition that you follow before stepping into the OT for the surgery?
Definitely, I'll pray and go.
Anything that you love about India that you miss in Dubai?
See, basically, I'm born and brought over here, but still, we are Indians, right? So that kind of feel is different. Here we can enjoy everything is there, but still, if you are getting a time back, we'll go back and come.
What's your all-time favorite cuisine?
I like this Arabic kebabs.
Yeah. One quick one on hair. How often have you started checking your hair in the mirror after the hair transplantation?
After removing my cap, definitely I'll try to comb.
One piece of advice you would give to any other doctor who's also considering hair transplant?
Work schedule, everything won't change much. That is the first thing. And you can adjust the timings according to your availability. We can arrange, and less of pain, and yeah, better to take in do it in 2 or 3 sittings. That's what
Yeah.
I came to a conclusion. That will be
Yes.
the advice from my side.
This conversation was very, very helpful to a lot of people who are listening. So they'll get
Okay.
that confidence, they'll get that motivation, especially if they're struggling with the hair loss and they are, in that decision making. And listening from you, that becomes even more valuable because
Yes.
definitely people get that trust and faith when they listen from
Yeah.
such a senior doctor discussing his own journey. So thank you
So,
so much, sir, for giving us your journey and story.
yeah, I'm very happy to say, because I myself am very happy with the results. So I'm happy to convey my share my things. How did I feel and how was the journey?
Yeah.
And definitely, it is a strong recommendation from my side for the
Yes.
Assure Clinic. Okay.
Thank you so very much. Thank you for your valuable time, sir.
Okay.
Thank you.
Thank you. Thank you so much.
Thank you.